Huples cat. I hope you're all having a great Wednesday. I have to go back to work tonight. I've had my 8 days off and I'm still sick. Still got a dry throat, still got unproductive cough, though it is a little bit green at times now, which means I might be getting a bacterial infection. But I have good air entry, so I'm quite happy. So I'm trying to answer questions such as I can online, and I'm also getting some email questions, which is great. I would remind you that I'm a registered nurse, I'm not an MD, okay? So I'm speaking based upon my opinion, and for medical information you should always go to medical people. Nor am I an occupational health nurse, nor am I an IP&C nurse, specialties. But I'll give it a bit of an answer. The first question is, how long does COVID-19 live on surfaces? The truth is we still don't know. You'll see a lot of things out there. I will put up some slides from stuff that I've gained and found out recently. It actually depends a lot, and I haven't really got into this, about the humidity levels in rooms. Strangely enough, what most people out there are probably thinking is that high humidity will make infection worse. I haven't really explained high humidity much. Most people probably think high humidity, that means lots of water in the atmosphere, will make infection spread easier. It actually has the opposite effect. When you have low humidity, viruses tend to stay in the air longer if they are in the air, whether airborne as a type of a gel or as droplet. And they also tend to live on surfaces longer if the humidity is low. So one of the things you could consider doing is actually putting a humidifier in a room. And I haven't gone into healthcare of somebody with COVID-19 yet at home without healthcare. But one of the things I am going to recommend is that you consider getting a humidifier. I am not really kind of bothering right now. I'm just going to leave bowls of water open. I'm not going to make an attempt to use electricity to make a humidifier. But higher humidification will make the virus less likely to transmit on surfaces and in the air. So one of the things you'll see is that there's no risk at all of getting infection from the virus on packages coming from China or Singapore or Italy or America, but you will have a low risk. There is a low risk. So I would say be careful. There's no particular reason if it's not raining why you can't leave packages from the grocery store and also from Amazon outside and turn it around and let the sunlight work on it for 5 to 6 hours. That's probably going to decontaminate surfaces. So the specific question was, if viruses don't live long on surfaces, why can't you just put the masks in a bag, wait a period of time, and then reuse the masks? And that's a pretty good question. One of the main reasons is that you have humidification from your own mouth, so you'll actually break down the fibers and make it more likely to infect you. Also, there's no guarantee that it's sterile if you just put it in a container and leave it. I think in theory it sounds good, but in theory I definitively, if I'm going to reuse an N95, I'm definitively going to put it in high bleach because I know it will kill it, and then I will definitively put it in the high sunlight for a day or two. I'm not anticipating running out of N95 masks. Now I might because of my job as a nurse, but I'm not anticipating that. The actual use of the N95, unless you are using them in the home to nurse somebody who's sick, is going to be very, very low. You've got to understand you won't be going to school, your kids won't be going to school, you won't be going to sports events, you won't be going out. If you're allowed out shopping, it'll be once a day or once a week or once every 3 days, and it'll be only one person. There'll be a lot of controls in place if this gets bad in your local area. You can see what's happening around the world, what's going on. If you're just walking down the street and the street's empty, have a mask in your pocket. You don't need to put it on. That mask you can put on, protect yourself, blah, 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 while you're walking past a group or whatever, or if somebody's asking you directions. Remember, keep them 2 yards, 2 meters, preferably 6 yards away, but at least 2 meters outdoors, away from you, and you can just put the mask back in your pocket. One of the things they suggest is using a desiccant powder, like, you know, those little packets you get that keep things dry. They're actually suggesting using them to reuse the masks. However, that strikes me as counterproductive because actually low humidification makes the mask more likely to have the virus on it. There's the old Baxter. She was on the sofa and now she's on it. Will she stay quiet? And the other question I got, because I alluded to my SHTF plans, where I have actually written out plans where I'm actually going to do this and that and this and that depending on what's going on. Now, I'm not going to show you my SHTF plan for pandemic because I don't think it's helpful. It's very personal, it's very localized, etc. But I had a really great question about from somebody that's in a town of about 10,000 people, has young children in elementary school, I think, and says what would be the key indicators for you, what should I be looking for? So what you should be looking for before you decide to pull them out of school is what I would suggest this. If you know anybody in healthcare in the area, or a police person in the area, or a paramedic in the area, and you know them really well, go and talk to them. Tell them you're very, very worried, and can they text you night or day if they think there's an issue. That's a really good early indicator that there's something going on in your local area. You'll get that information long before the local press or you find out on the paper. The other thing I would look at is your school. Absolutely, if you have children who can tell you if other children are showing signs of influenza, they should know that. They should be teaching even kindergarten children what the signs are and how to cough and all the rest of it. If they spot that happening in their school, they should be telling you when they come home from school, and you call in and tell the school your child's sick. If it is COVID-19, it seems to be about a 2 to 4 day latency period before the schools and the authorities realise and shut the school. Just pulling your child completely out of school right now is obviously the safest thing to do, but it's also very difficult and financially problematic for a lot of people. I believe England fines people £60 a day if their children don't attend school. So while I'm on that subject, it's kind of linked. Schools in England have allowed children and teachers who've been in northern Italy to attend school because the health authority in England says unless they've got symptoms of flu, it's fine for them to be at school, which is absolute rubbish. They need to be in 14 days voluntary quarantine. Now I would argue 28 days, but let's face it, nobody's going to do that. But they absolutely shouldn't be going to school within 2 weeks of being in an exposed region. Absolutely not. That's absolutely crazy. That's like we have nurses coming back from China, and I argued about, well, are we screening them? And that was like, we don't need to, it's just Hubei province. Anyway, they did put screening in for staff coming back from China. So today, on February 24th, there is still no screening at all from staff who've come back from anywhere else in the world other than China. That again concerns. We are seemingly always one step behind this, always reluctant to do an increased level of precautions until they get to the point where literally deputy health ministers are catching it, and then they just close the entire town down, or the city or the province down. And I don't think that's a good idea. I think people should be moving around and transporting vehicles and going to work, but I think they should be using sensible distancing and face masking to do that. So it's like one thing or the other. They're not taking it seriously, they're not doing enough in my opinion, and then they're doing far too much. And unfortunately, I'm not the leader of the World Health Organization, but if I was, I would have handled this a lot differently. And this is a pandemic. There is human-to-human transmission outside of China in other countries that is not directly traceable back to China. That's the definition of a pandemic. We are in a pandemic. Now, how bad is this going to get? I don't know. I really don't know. I could, for all I know, have it now. Nobody's going to test me in Canada because I haven't been to China. So I'm just going to put a few slides up. They are text slides, so if you like pictures, you're out of luck. And I'll explain what I think about what you're reading and my thoughts on it. So this is what the hospital's updating us. They're doing this every day or two, letting us know what's going on. Main message here is Iran has now been added, and telling people that they should be screening people properly, and if they're intubating, put them on life support, they should be doing it properly. Well, what exactly does that mean? So what it means is, if people have visited these countries within 14 days of admission to our hospital, we're going to consider COVID-19. Again, 14 days is far too short for some patients. China, Hong Kong, Iran, Italy, Japan, Macau, Malaysia, South Korea, Singapore, Taiwan and Thailand. But I would point out that Vietnam and a few other places may have this, and we're not actually triggered into looking at it yet. Bit of a busy technical diagram. Would point out that they are still recommending N95, and it should be fit tested, and they're recommending a gown, gloves and face shield. They're still not recommending goggles. They still seem to claim that it isn't airborne, it can only possibly be droplet. Again, China were using goggles, and a lot of the staff there felt that they're not using goggles is what caused them to catch the infection. Just exploded the box on the right so you can have a look at it, so you can get all hip with the terminology on your live streams. An ARI is an acute respiratory infection, so any acute respiratory infection, not a chronic one from COPD. So this would be an ARI, and you can also have temperature from that, which is called febrile. So you have a febrile respiratory illness, also called a fry. So there are two terms you can throw around on live streams. Look kind of cool. For any of the paramedics or nursing doctor staff that watch this, they've changed this for intubations, putting people on life support. They were saying clearly they wanted a level 4 gown, and now they're saying no, it's fine. The level 2, the yellow cloth gown, is fine. Again, I don't really buy that. I want a level 4 gown on. I don't believe in taking lower precautions. They're saying no, cloth gown's fine for intubation. Don't agree. Again, it's part of the life support thing. What they're basically saying here is BiPAP, CPAP, all of that stuff shouldn't be done, nor should nebulizers. So it's interesting that the lessons from SARS have been learnt from this. But what doesn't seem to have been learnt from the lessons from SARS is that if staff catch something like MERS, they will have a 60% death rate. So that's not great, is it? So I do think that the hospital should have actually spent the time, energy, and given us sealed respiratory units like HEPA hoods to wear, and just to go with the N95 because that's what WHO recommends is a bit bad in a first world country. So this is a slide about to come out from the World Health Organization, and I think you can read this and you can see exactly what they're trying to point out. They're pointing out that we're not going to have enough N95s, let alone surgical masks, and we know surgical masks don't work. So what does that actually lead you to have to be able to do? As a healthcare provider, what I'm doing is I'm making sure I have enough masks, and if I don't have enough masks, I'm making sure that I'm going to be able to use reusable, single-use materials that are going to give me a high level of infection protection than not having a mask on at all. I'm sorry, I don't buy the fact that they're claiming that you don't need a mask for most things. It's utter nonsense. If that was true, nobody would be catching it by sharing chalets. People are catching this in not very intimate contact. Most of the contact is family members, etc. But a significant number of the contacts that we know about in Europe, and that's what I was waiting for, was the European people from this, don't, to me, appear to be particularly close contacts. That to me implies this is severely droplet with possible aerosol, and masks are utter essential if you're going to be close to anybody who might be infected. Remember, a lot of known unknowns remain unknown, and we have to see how this is going to play out. It's not the time for fear. The death rate is not crushing. I think the British Health Minister said, look, only 5% of our people are going to get really sick from this. It's no big deal. Interesting way of putting it, 1 in 20, yeah, from a species survival historical point of view, that's not a big deal. But if we're going to have 1 in 20 people potentially in certain areas of the world, not everybody will catch this, but in certain areas of the world, 1 in 20 people are sick enough to be hospitalized, that's going to be an absolute crushing blow for a period of time. And if 1 in 20, 1 in 40 dies from this, that's going to be significant. And nobody should kid themselves that this is going to be nothing much and it's just flu. It isn't. It can weaken at any time and disappear. That's what I'm hoping for. It can also stay the same, in which case I think we're going to have areas like Wuhan City all over the world within a few weeks, maybe a month. Or it could get stronger and we could have a second wave. More on that once we've dealt with this one, I think. That's it from me. Remember, SHTF, tomorrow will always be worse than today, unless you prep. So let's start prepping for a pandemic, which we're in. Toodles.